I say there's 3 components to a standard abdominoplasty: a removal of the extra skin, transposition of the belly button. So we moved past the belly button thing, but we'll talk about it. That means we're going to cut around the belly button, pull that extra skin down, and bring the belly button out through a new incision. So that's part 2. So you've got removal of the excess skin, keeping the belly button, but you're bringing it out through a new incision, and then the diastasis, recti repair. So those are the 3 components. And I tell patients a mini abdominoplasty, just like mommy makeover, is defined by the surgeon. There's no agreed upon term. So a lot of times they'll call it a mini if you're just taking out that lower piece of skin. And then you can only do that up to so much, because if you take too much, you're just pulling on the belly button and you're going to like yank it down. So then you have to either disconnect the belly button from the abdominal wall, and it's called a float the belly button down. But as you can imagine, you only want to do that about 1 centimeter or so. And it really then, if you start looking at patients, like where is their belly button in relation to their torso? And you don't want to create a look that looks weird. I mean, some people have a little bit of a weird torso anyway, and their belly button's like it's not actually centered in between their ribs and their pelvic bone, but it's usually like 2/3 down, but there's a little variability. So you can maybe take a little bit more skin and float the belly button. But if you get too aggressive, you don't want to take the belly button down to, their lower abdomen. It looks insane.
So you never actually remove the belly button, because I do feel like I get a lot of this question from patients after the procedure.
Yeah.
And they're like, oh, do they just take it off and relocate it?
So for a traditional abdominoplasty, no, we cut around the belly button. It stays attached to the abdominal wall. And then I'm like pulling down like a window shade, the skin over it, and then bringing your actual belly button out through a new incision. And how that incision is made is kind of one of the nuances of doing a tummy tuck. So the way I like to do it, and I think plastic surgeons who do a really good job with tummy tucks, are you're creating a little bit of an upside down U, and then you're tucking the belly button in so that the bottom part of the incision ends up tucking in. So it's not a little incision all the way around. I think traditionally we used to go all the way around, and it looks, so her belly button is pulled up and gives that kind of nice natural look. And the bottom of that incision, even though it goes all the way around, is tucked in. So sad belly button, happy belly button.
I've seen a couple pictures where the belly button, I don't even know how this happens, but it's like up high and very off center. And it's like,
yeah, I mean, it's where they make that other incision. So there is a famous surgeon in Colombia who has, at least he was advocating, Dr. Alfredo Hoyos. I saw him do a presentation where he decided, after studying women's torsos, where the belly button should be put in an ideal setting, like in an ideal aesthetic. And so he just takes away your belly button when he does the surgery and leaves you with no belly button. I am not making this up.
It's like Kyle XY, or what was that show? They thought he was an alien because he had no belly button.
And then 7 days post-op, he decides where your belly button should go and makes you a new one, which seems very like God complexy, in my opinion. Like, just keep your belly button.
So, but the belly button is still attached. He doesn't take it off, correct?
I don't. He does. He just throws it away.
And it stays. Oh.
Yeah.
I was like, how does that stay alive?
I mean, it doesn't stay alive. I honest to God thinks he can make you a better belly button than the one you have. So he creates it completely new from flaps.
Oh, interesting.
Yeah. And that way he could decide exactly where he wants it.
Through a whole, like, another little procedure a week.
Yeah. Whatever. I don't know how long he'll do that. He presented it at a meeting, and I thought, okay, I'm just going
to
see if next time you present, you're still doing that.
I've changed my method after careful consideration.
Women do not like being told where their belly button is going to be. Right? I mean, come on.